A stroke can strike fast, and every second counts. If you're over 60, knowing the signs can save your life or someone else's. Stroke is one of the leading causes of death and long-term disability in older adults, but it doesn't have to be. When caught early, many strokes can be treated or even reversed. The problem is, too many people wait too long because the symptoms seem small or confusing. They think it's just a headache or a bad day or something that will pass. Let's make this simple. There are two major kinds of stroke. The most common is called an ischemic stroke, caused by a clot that blocks blood flow to the brain. The other is a hemorrhagic stroke, caused by a blood vessel bursting. In both cases, brain cells begin to die almost immediately because they're starved of oxygen. The longer you wait, the more damage is done. That's why doctors say, time is brain. So, what are the warning signs? First, pay attention to the sudden onset of weakness or numbness, especially on one side of the body. If your arm suddenly feels heavy or your leg buckles for no reason, don't brush it off, even if it goes away. That could be a mini stroke or TIA, and a full stroke may follow soon after. Second, be alert to changes in speech or understanding. If you suddenly have trouble speaking clearly, slur your words, or can't find the right words, that's a red flag. The same goes for being unable to understand what someone else is saying. These aren't just senior moments. They're serious neurological signals. Third, notice facial drooping. This is one of the easiest signs to spot. Look in a mirror or ask someone if your smile looks lopsided. If one side of your face looks like it's sagging or you can't move it properly, call emergency services immediately. Fourth, if you suddenly lose balance or coordination, stumble while walking, or feel dizzy out of nowhere, that could be your body's way of saying the brain is in distress. This isn't the same as feeling off balance from low blood sugar or dehydration. It usually happens quickly and feels abnormal. Fifth, keep an eye out for vision problems. Blurred vision, double vision, or sudden loss of sight in one or both eyes is common during a stroke. Some people describe it as feeling like a curtain was pulled over one eye. If your vision changes suddenly, especially along with other symptoms, do not wait to see if it gets better. Another big one is a severe headache, especially if it comes on fast and feels different from any headache you've had before. A hemorrhagic stroke can cause this kind of pain, and it may be accompanied by nausea or vomiting. If you've never had migraines but suddenly get a pounding headache out of nowhere, get checked right away. Sometimes the signs are more subtle. You might feel confused, disoriented, or sleepy in a way that's hard to explain. You might have trouble walking in a straight line or feel like the world is spinning. You might just feel off, and that gut feeling should never be ignored. The key to remembering all this is the acronym FAST. F stands for face. Is it drooping? A stands for arms. Can you raise both, or does one drift down? S stands for speech. Is it slurred or strange? T stands for time. Call emergency services immediately if you notice any of these. Do not try to drive yourself. Do not take a nap to see if it passes. Call 911 or your local emergency number, even if you're not completely sure. Paramedics can begin life-saving care on the way to the hospital, and many treatments are time-sensitive. For example, the clot-busting drug TPA can only be used within a few hours of an ischemic stroke. Miss that window, and the damage may be permanent. Now, what about symptoms that disappear quickly? This could be a transient ischemic attack, or TIA. It's sometimes called a mini stroke, but don't let the name fool you. A TIA means there was a brief blockage in the brain that resolved, but it's a serious warning. 1 in 3 people who experience a TIA will have a full stroke later, often within days. If you've ever had a sudden spell of confusion, weakness, or speech difficulty that got better in under an hour, talk to your doctor immediately. There are also strokes that sneak under the radar, known as silent strokes. These may not cause dramatic symptoms, but still damage brain tissue and increase the risk of future strokes. Over time, they can lead to memory problems, difficulty concentrating, and balance issues that are often mistaken for normal aging. The bottom line is simple. Any sudden, strange, or severe change in your body or mind should be taken seriously. Time is the most important factor when it comes to stroke treatment. Every minute you delay can make recovery harder or even impossible. And here's the truth. Many strokes are preventable. If you're over 60, it's important to manage your risk factors. High blood pressure is the #1 cause of stroke, and keeping it under control is one of the best things you can do. Diabetes, high cholesterol, smoking, excessive alcohol use, and an irregular heartbeat called atrial fibrillation also raise your risk. Make sure you're taking your medications as prescribed, getting regular checkups, and staying physically active. Eat a heart-healthy diet rich in vegetables, lean proteins, and whole grains. Keep stress in check and limit sodium and processed foods. If you've already had a stroke or TIA, follow your neurologist's recommendations closely. The second stroke is often more severe than the first. Another tip, know your numbers. You should know your blood pressure, cholesterol, blood sugar, and heart rhythm. Many pharmacies offer free blood pressure checks. If you have a home monitor, use it. And if anything seems off, bring it up with your doctor, not next month, but right away. For caregivers and loved ones, learn how to spot the signs too. Seniors often downplay symptoms or try to wait things out. If you see something unusual, a sudden slur in their speech, confusion, or a funny look on their face, don't ask if they're okay. Take action. Call for help. It's better to overreact than to lose precious time. There's no shame in asking for help. There's no bravery in toughing it out alone. Stroke doesn't care how strong you are, but acting fast gives you the best chance to walk away from it with your independence intact. So take this seriously. Share it with someone you care about. Stick fast on your fridge or near the phone. Knowing the signs might just save a life.